Well, hello. I am sitting here with many wonderful people from our community. And let me just do a quick introduction for you. I have our Councilman and Mayor Pro Tem Devin Reese right here, and Councilman Oscar Delgado. We have Pastor Cesar Minera. We have Ann Silverman, who is the Chief Executive Officer over at the Chamber, and then Laura Thorworth with the Census Bureau. And I'm Kristopher Dahir, City Councilman in Sparks, and we are all coming together to make sure everyone understands the necessity of our census. And we're going to focus in on a few different things that are crucial. But today we're going to talk about healthcare. Real quick, I want you to know the areas of WIC. WIC is how we help women, infants, and children. And I'll tell you what, there are a lot of different kids on this, a lot of different families. What happens is we go in and help families with this. When the census comes through, it gives us the amount of people we're allowed to help, percentage of finances that come in. And with CHIP, the Children's Health Insurance Program, we have 9.6 million, that was in 2018, kids in this program. We have so many people who are affected. And just a thought as we talk about all these different areas, every time we say yes, it's like we're doing a fundraiser. It's because your family counts as $2,000 a person in your home, $2,000 a person in your home per year, and that's for 10 years. So that's quite a fundraiser you get to be a part of for all these great programs of health. So let's begin and just start going around the table here. Devin?
Yeah, hey, thanks. Appreciate it. I want to, I guess, maybe start at the beginning. For me, as I think about the census, it really is about data, right? All of us understand the process of counting folks. That data, though, begets more data, and that's really why it's important to all of these programs that we're going to talk about today. You know, data, for example, influences the way that the federal government identifies the poverty level. And of course, many of these programs then use that poverty level to determine access points and to figure out how that poverty level would be applied on sort of a means test for people who are needing the service. So at a very foundational level, everything that we're talking about on this call relates back to that. In addition, of course, I think it is crucial that people understand that, you know, the groups of people who are most underrepresented and the most likely to not be counted are oftentimes the ones who most need the kind of services that come from the kind of data collection that we're going through. And so I think that's super important. One real specific example I'll give is how we fund rural healthcare, for example. I mean, this data will tell us what is an urban area, what is a rural area, and that helps to determine what kind of funds go to each of those areas. And so I think if we just continually understand this process as one of data collection and one of making that data beget other data, then you start to see how it affects the CHIP programs, WIC, all of the other programs that we'll talk about. And so it's important because if we're not counting appropriately, we're really not telling an appropriate snapshot of who lives here and how they live. And so all of those things are important, and I'm so happy to be part of the conversation about it. I know that folks on this group here really understand that process, but hopefully we're sharing it in the communities that we have the opportunity to share it.
Thank you so much. And Ann, if you want to go ahead and share, that'd be great.
Sure. Ann Silver with the Reno Sparks Chamber of Commerce, and we're excited that we have over 1,900 members who employ collectively about 90,000 residents of the community. And we want businesses to do their part by encouraging their employees to participate in the census. No one should be left uncounted. Everyone should give time to their employees to do this online, by mail, by phone, to ensure, as Councilman Reese said, that the data matters and will matter in terms of the money that's dispersed to Nevada and can support so many of these programs that go to support a healthier community.
That is wonderful, and I appreciate it. Ann does a lot of work, and I'll tell you what, we'll continue to bring things for businesses right to the table here. Pastor Cesar, what would you have to share about this?
Okay, probably being a member of two big groups in the community, one, the faith community, and then the Hispanic community. One of the questions that usually arises when it comes to the census with the Hispanic community is it safe to do it? So in this case, yes, it is definitely safe to do it. I wouldn't be here, just encouraging people to do it. And it is very important Reason being is, as it was already stated, having the right data would bring funding for our state for many programs that would definitely benefit the Hispanic community in many ways. So as it was already mentioned, it's probably the easiest fundraising program that we can be a part of. So if you're a member of the Hispanic community, it's something really safe to do. And we encourage the faith-based community to be a part of it, because as we all provide the right information, it would produce obviously great things for our state.
Thank you so much. And we have another councilman here. What do you think about all this, sir? You're involved in this all the time.
Thanks for having me again, council member. To me, the census and all the data and information that we're able to gather are just, they define life-changing opportunities and life-sustaining opportunities for so many who are, for a lot of our families that are not able to participate a lot of times, to have the opportunity to sit around the tables during discussions related to just resources or changing policy, change dynamics within their own communities, because they're out there working. And so it's just to all of us to make sure that we use that data appropriately, that we're able to fight for those numbers, because ultimately, again, those are dollars that a lot of times the cities don't necessarily have. So we depend on those to make those life-changing, life-sustaining resources available to all those families as they come in. So it's very important. So thank you for having me as part of this conversation. I think everyone's touched on those points. And excited to be a part of it.
And I want to ask you too, we're in the middle of this COVID-19. We have a lot going on.
Yeah.
What role do we're talking about the census count really goes right back to these numbers, don't they?
Well, it's huge. Right now, I'm also the CEO of Community Health Alliance, which is an FQHC. And FQHCs across our communities were created in the 60s as a war against poverty. I mean, they're essential to be resources, primary care resources, primary behavioral care resources, dental care. I mean, talk about the essence of making sure that people are healthy throughout their time in any community. And those numbers are heavily based on data. They're heavily based on population. They're heavily based on demographics. And we pull that information, whether it's daily, weekly, monthly, it's ever changing, but those are life-changing circumstance resources that we need to make sure we have funding from the federal government to help us sustain. And this is a perfect time for us to talk about what life-changing opportunities we are able to do at Community Health Alliance as an FQHC. We have so many members in our community that are scared.
Yeah.
We have so many members in our community that just don't know their circumstances, or are also just curious about their own health. And so now we're dealing with this, having them make sure that they have a safe place to come to at Community Health Alliance or other FQHCs across the nation, that we're able to take a look at what their primary care, being the primary care place to say, how are you right now? How are you feeling as a trusted neighbor? How can we make sure you feel safe when you go home? What are some trusted information that you can take home with you? Because that's the other issue we deal with. There's so many resources, so many different news outlets out there that can be confusing for people, and they need a trusted place to go. And so they ultimately come to places like us to be able to pull that information and go home and make sure that they're safe during these circumstances. So that all starts with data. It all starts with the collection. We are also one that works with the homeless community, those experiencing homelessness. And those numbers are essential for us to make sure when we talk to our federal delegation or talk to DC to say, these are so many people we're serving right now. We provide that information to HRSA, that provides it to the feds, provides it and says, we're seeing 1,000 homeless within our own organization. These are their symptoms. This is what they're currently dealing with hopefully results into understanding that we're probably going to need more ventilators. We're probably going to need certain types of specialty doctors to come in and deal with that if they get sick or if they end up in a hospital.
Well, here again, we have some incredible people on the line here, and we really want to thank everybody. I know we have Ann, who really representing our business as our Chamber of Commerce. Just thank you so much, and appreciate all that you do. And then Councilman Devin, thank you for joining us. We'll have more conversations in the future. Anything else you want to add before we're done, sir?
Not for me. I thank all of you for helping out on this important cause.
Pastor Susan, thank you for being here. And I'm going to take us to, well, I want to make sure I say thank you to Oscar as well. We can't forget thank you. Really, really appreciate. I know what you're doing right now is definitely on the front lines, Oscar. But I'm going to go to Laura, and she's going to tell you how you actually go on and be a part of the census. You might be wondering, how do I do this? Because we just told you all this important need. So Laura, welcome. What do you have to say?
Hi all, thank you so much for taking the time to talk with us about the importance of census data and how it relates to healthcare. It's so crucial, especially at this uncertain time, that we make sure we are getting as much funding back to the state as possible, like we've stressed. So when you're ready to fill out your census, and I really urge everyone watching this to encourage themselves, their friends, their family to fill out their census as soon as possible, you want to go to census.nv.gov to fill out your census. It takes maybe 10 minutes depending on the size of your household, 5 if you're just one person. Super easy, very simple questions. It's safe, secure, and so important. It's money back into your community. So make sure you get counted. Make sure you're counted in history. And that's all from me. Thank you so much.
Well, thank you. We'll have more information coming to you very soon, but that's it for now. Thank you so much. Thank you all for being here.
Thank you.
Thank you, everybody.
Thank you.